So I'm going to start by introducing Sherrie Orr and Dr. Saman, who are speakers as part of today's panel. And we will be talking about research finances, budgets, justification, and strategy. Sherrie Orr is a graduate of McMaster University and began her research coordinator career with McMaster in 2001. She's worked with CE&B, which is clinical epidemiology, Department of Surgery, Department of Family Medicine, as well as on industry studies. So Sherrie brings a wealth of experience from the research coordination side, having worked her way up through the system. Constantine is an associate professor in the Department of Pediatrics and a staff physician in the Division of Pediatric Endocrinology. He leads a translational research group with a focus on defining mechanisms and interventions to treat and prevent childhood obesity and diabetes. And Dr. Saman is also director of research and scholarship at the McMaster G. DeGroote School of Medicine at McMaster University in Hamilton, Canada. And I've met many of you before as a McMaster Center leader and also an associate professor of pediatrics at McMaster. And most of my research is clinically focused. So we've got some researchers with some different research backgrounds, but all of whom have to deal with research finances. So with that, the objectives for today are to understand the structure and components of a research budget, to review examples of clinical and translational research budgets, both large and small, as these present different challenges, to understand the importance of the budget justification in addition to the budget itself, and to talk a little bit about strategic considerations in crafting and managing research budgets. The budget outlines proposed cost of a project, provides funders and reviewers with a clear plan of what you intend to do, and it also supports financial tracking of your project. For the new trainees or people that are new to creating research budgets or trying to develop their first grant, it's important to understand that research budgets typically have this structure, regardless of which funding agency you're applying to. The personnel section, which Sherrie will speak to, materials, supplies, and services, equipment, and travel and other expenses. So without any further ado, I think we'll be moving on to the personnel section. Sherrie.
Hi, everybody. Nice to meet you. So if you just want to move to the next slide, Melissa. So you can see from this slide who can be paid from a grant: research assistants, coordinators, project managers, lab tech, lab manager, trainees. The principal investigator and co-investigators cannot be paid from a grant. And clinical time, like physicians who are going to help out on your project but may not be a co-investigator, they can't be paid from the grant either. It's important to think about when you're doing your budget. I know it's hard for PIs to understand how much time it actually takes to do a lot of the research activities because you're looking at it from a larger point of view, but there are a lot of research tasks that take up a lot of staff time. So when you're building your personnel budget, it's really important that you factor in those tasks that you may not be aware of. So reach out to other people. If you can, talk to your department HR to get a really good idea of how long it's going to take research staff, how many hours a week is going to be needed to budget for research staff and any of the other staff that you need to facilitate the project. So it's important also that you don't underfund the personnel costs, because once you run out of money, you're out of money. And research staff are soft funded. We're paid by, for instance, the university, but the grant money goes into an account and that's what pays us. So if the money runs out and the project's not done, you're going to be scrambling on how to figure out how to finish up the project without any staff. And it's also important to know who you need to run your project. So research assistants are a lot less expensive than research coordinators, but in often cases don't have the experience of a research coordinator. So can run the study in that they can recruit patients and do consent and do data entry, but a lot of times don't know the higher level regulatory tasks that need to be done. So it's really important to think about that when you're planning your budget. I think, so you can follow the Tri-Agency Guide on Financial Administration for any budget you're doing for any project. It gives some really good guidance on how to do your budget. Once again, it shows, who's eligible for salaries. It's important to check your financial institution's salary grids. It could be union or non-union, but you will also have fringe benefits that you need to add to your budget. I know for McMaster, there is a fringe benefit table that you can look at. So for instance, the more you make, the less percent of fringe benefits you need to account for. So for instance, somebody who makes say 85,000 a year, their fringe benefits would be about 30%, where somebody who makes 50,000 a year, their fringe benefits could be 37%. So that benefit table is really key to look at. And Melissa just brought up the McMaster salary grid. So this is what people were being paid up to May 2nd, 2021, which means our contract is now up, but that's a whole other story. So you can see it goes by grades, and the job descriptions are coded by grades. So for instance, a first level research assistant would be a grade 6. A research assistant who has a little bit more experience would be a grade 7. A research coordinator level 1 would start at a grade 8. A level 2 would be a grade 9. A level 3 would be a grade 10. So, and with the increasing levels, of course, you get increasing experience. So yeah, you might look and say, okay, I can get a research assistant for around, $24 an hour, but that person may not actually be able to effectively run your project. You might need a level 9. And people that are already in the university working, so for instance, if somebody's moving to you from a different department, they could already be a level 9, step 5. So when they come to work with you, they can't go down because it's a union environment. They would go up to the next step, a step 6. So you have to factor in all the union requirements too when you're looking at personnel costs. So the steps, every anniversary of your hire date, you go up a step. Every contract year, you go up a grade. If you've changed positions. So for instance, somebody who's at step 8 and gets hired, or sorry, somebody who's at grade 8 and gets hired at step 4 in September, in January, if that's the month that they were originally hired, they would go up to step 5. And then the following year, they would go up to step 6. Plus, they would get a union raise, which would be the next grid. Like it would be about 2% on top of that. Once people get to step 10, they get no more raises on the grid. They only get the yearly raises through the university or through the union, sorry. So that's how that works. And a lot of institutions have grades and steps, but most of them don't go up as high as step 10, because what the steps are telling you is this is how long it should take until you're like an expert at your job. And the argument is that it shouldn't actually take 10 years to be an expert in your position. So there is some talk about taking away a number of steps within the grid. But that just gives you an idea of, the the difference in positions and salaries.
Sherrie, that's a great example of how complicated this can get in terms of the idiosyncrasies of a given institution. Not all staff are unionized. And maybe could you just comment on, how being full-time or part-time can impact things like fringe benefits and how that can sneak up on PIs?
Yeah, so on top of this salary, this doesn't include fringe benefits, what you're seeing in this grid. So you have to add on the fringe benefits when you're doing your budget. Now, Melissa we had a conversation just before this meeting about, for instance, McMaster staff versus Hamilton Health Science staff and legacy costs. So at McMaster, included in the fringe benefits is a sum of money that gets put into what they call a severance pool. So when it's time for somebody, the project is ending and you have to give notice, that person's severance is paid from a pool. Whereas HHS, they don't have a severance pool. So if you're the last PI working with that staff and you have to give them 6 months severance, but you don't have the money to cover that from your research budget, then you're going to be covering it out of your own pocket. And those are different things that when you're hiring staff, you really need to contact your HR to find out, what's the best route for you. Because I didn't even know about the severance pool that Melissa brought up to me. And so when you're looking at hiring staff, you also have to keep in mind, when do you give them their notice? When it's a contract and the person's, say, interim or casual employee, then when their contract ends, that's their notice. But when you're a continuing employee like me, who's been at McMaster 20 years, I almost get 6 months notice. So Melissa has to think about her finances and, plan out when can she pay me until, and I keep an eye on that for her as well, as most research staff will do. But more inexperienced research staff won't know about that. So those are things you have to really keep in mind.
Hopefully I can keep you forever, Sherrie. Derek, I see that Derek has a question. I think we'll try and minimize questions during the presentation because we have a lot of content to cover, but do you have something that maybe Sherrie can answer?
I wanted to add that at Hall and Bloorview, occasionally we also run into the issue where if staff are paid vacation and benefits in lieu, what can happen then is it creates a relationship between the supervisor and the staff that when you're asking them to take their vacation, the staff starts to view that vacation as being unpaid time that they don't want to take.
Yeah.
But if they don't take their vacation, you're essentially end up paying them for an extra month a year of work that you didn't budget for. So that's something to watch out for as well.
And that plays into thinking about who you need to hire for the position. Because if you're hiring somebody where you're paying in lieu of benefits, that's more of an interim or a casual employee. And is that really the right person to hire for your project? For instance, if you decided, if you wanted to keep your budget lower because you thought you might get a better chance of getting funded and decide that you're going to hire a research assistant at a grade 6 on this grid, but when they come in, they're actually doing the job of a research coordinator and you're in a union environment, they can grieve that wage and it could get bumped up to a grade 8 or a grade 9. So you have to be really cognizant that you know what your needs are for your project and you're hiring at the right level.
Yeah, and that delves into a whole other level of HR issues, which I think we'll move on for the sake of time. But it's important to remember that while Sherrie works with me full time as a coordinator, she's not my employee. She's an employee of McMaster University. And so there's you just have to remember that dynamic in terms of relationships. And as you pointed out rightly, it's not just what the costs are, but that you're hiring at the appropriate level to get the services that you need. So speaking of services, we're on to supplies and services, and Constantine's going to cover that. Thank you, Dr. Suman.
Thanks, Melissa. So I think one of the things that are important to know about budgets is that they are one of the feasibility criteria reviewers are going to use to judge whether this project can be done. So it's important to ask for what you need to get the project done within the limits of a particular grant. But also remember that the reviewer is not going to pay more for what the ask is. They're going to pay less, perhaps. They're going to cut the budget, but they're not going to give more. So it's important that the ask actually matches what the needs are. And in terms of supply and services, it's important to know what is needed for the project. So if certain devices are needed, for example, laptops or pedometers, if you're measuring something in a study, software can also be covered, voice recorders if you're doing a qualitative study or a focus group where you're collecting data. Things like animals and lab services are really important to get the right numbers on. Now, these can involve information that can be provided by central animal facilities within institutions, central lab services that usually manage studies, and they can actually provide quotation and a breakdown for the services that they provide. For example, animal facilities can provide a variety of services, including not only housing and feeding, but providing certain interventions, cross-breeding, genotyping, other interventions that are necessary depending on the facility. And central lab services can also provide things like histopathology services, measurement of certain analytes. So it's important to actually connect early with the different offices that manage these aspects of a grant for you so that you can get quotations and you can actually include those in the grant application. Funders usually expect us to provide incentives, things like gift cards, for example. Parking costs are usually significant, and it's important to, again, ask for those. When it comes to running a study, especially a trial, like a randomized control trial, again, depending on the institution, you might have access to collaborators that might help you with this, but sometimes there are central offices that can help provide services like randomization. They can provide data analysts if you don't have one. Things for transcription, for example, for qualitative studies, again, can be requested. When the work is done, there's going to be a publication cost that, again, can run into the thousands of dollars. And typically when we report in a grant, we would kind of project what publications we might see coming out as the main papers, and we can actually ask for costs of those. If there is a knowledge translation component or an information component like a website development, these costs can actually be requested as well. When we look at the knowledge translation, for example, from the tri-agency, the development of the website, if you hire someone to help you develop that website, these platforms, you can actually purchase a domain and you can pay annual maintenance fees, which again runs into the hundreds of dollars per year. Sometimes, again, the cost of generating videos or CDs that you can distribute, the preparation and the publication cost, as we've mentioned, the cost of holding a workshop or a seminar, and the activities are all, again, related to the funding research, depending on how you want to kind of disseminate that knowledge. Our ongoing costs can be built into the grant. Next slide, please. Equipment then. Next slide, please. So from an equipment point of view, depending on the grant, some granting agencies do not actually allow equipment purchase as being part of the budget, but some do. Some grants are specifically designated for equipment. They're called CFIs, in which the institution can actually support the purchase of significant equipment, like a major big microscope or a big device, a big MRI for research, for example. But some grants allow smaller costs that can be actually budgeted for. Travel costs to source out these devices, again, sometimes is allowed. Warranties and service costs are also allowed. to do. Training staff, especially if it's a very specialized piece of equipment, that again can be requested, and the ongoing maintenance and operating cost of equipment. And I would emphasize that that last component is actually a very important component for equipment that are specialized. And again, that cost can be not a trivial. So it's important to link with the manufacturer, get those quotes and provide them within the application so that people are aware actually there's been forethought and how these are going to get funded.
Constantina, I remember when I first started and was working on developing my first research grants as a new PI, I was very confused in terms of the line between supplies and equipment. Something like a laptop or a voice recorder, I would have thought was a piece of equipment, but it's actually a supply. So are there other examples like that you can think of that stick out?
Yeah, I think that's a good question, Melissa. I think for me, equipment are things, for example, if you're buying a PCR machine, or if you're buying gel boxes for your Western blot, or if you're buying, again, a big piece of equipment, if you're allowed to do them. So that sort of, kind of category would be what we consider as equipment. Laptops, yes, I don't think most agencies wouldn't consider them as a piece of equipment. They'd be more something that you would use within as an unconsumable item within the research that you're trying to do.
Can I jump in for 1 sec, Melissa?
Sure.
So I just wanted to say about equipment that there's no really great definition with the granting agencies. It almost seems like so many, everybody's confused about that category. One key thing that they do say is if has a lifespan of like a year or two, then it's a supply. But if it's longer, it's equipment. And their best advice is, if you're really not sure, email the granting agency and they'll tell you if it's equipment or not. And then I also just wanted to add for like the supplies and services, for instance, when Constantine was talking about getting quotes, how imperative that is, because if you, like, for instance, if your patient needs to have a chest x-ray, if every participant needs one for the study, you get a quote from diagnostic imaging for that, and that quote is for the lifespan of the project. So they can't raise the cost of that chest x-ray. So if you don't have that quote, they can do that to you.
Yeah, an example that we had, Sherrie, was that we had a relationship with the lab regarding a project. And actually during the lifetime of the project, the lab instituted, what was it, a $3,000 per project fee that they instituted, but we were already grandfathered in, so didn't have to pay that. So, it's always a moving target, and yes, try and get grandfathered for costs that you don't want to have to cough up later. Okay, travel and other expenses.
Is that me?
Yep, I think you are going to cover that in the next slide as well.
So yeah, the funders will typically allow travel expenses. They have to be reasonable. Your airfare has to be economy. They'll allow cancellations, insurance, seat reservation. For meals, your institution usually has a per diem rate that you would use for your budget. Once again, it has to be reasonable expenses. They don't cover alcohol, and they don't cover passport fees or reimbursement of airfare purchased with personal flyer points. When you look at the guidelines, it'll pretty much set out exactly what they'll allow and not allow in this category. They will allow recruiting costs for personnel and specialized courses. Costs of memberships in a specialized organization, they will allow some of that, but once again, you're better to check with the funding agency before you put it in your budget to make sure it's allowable. And then we're just going to talk quickly about industry funded studies because they have a different set of costs that academic or investigator led studies do not. So you can see with research ethics, and they've raised their prices recently. General application is now $3,500. An annual renewal is $300. They never used to charge for an annual renewal, but they do now. And they also charge $750 for every major amendment. So that's a significant cost. And then on top of your budget, you charge a 30% overhead charge, and HHS gets that, and they divvy that overhead charge up between McMaster University and the PI. I think the PI gets a 3% kickback from that. So it's always, you know, if you're dealing with industry, always check to make sure that these fees have not gone up, or that they haven't added any of these fees, any more fees to higher it or overhead.
Yeah, this is a good example, Sherrie, of when you're referring to institutional overhead, your university or hospital is going to want to make sure that anytime you're applying for money that you budget for overhead whenever it's allowed. A lot of times it's not allowed. It's not allowed by the Tri-Council agencies and some other academic funders, but they will scrutinize your budget and make sure that you've budgeted to help keep the lights on anytime it's allowable.
Yeah, and CIHR does give money to the university for overhead. I think it's a percentage of whatever has been allowed or whatever has been granted for that year. CIHR gives a percentage of that to the university, and the university divvies that up between departments. And so that's where they get that overhead charge from the Tri-Funding Council agencies.
So when it comes to actually preparing your budget, you want to, it can be overwhelming, but what you want to do is create a list of activities from the beginning to the end of your project and think about what resources that you're going to need along the step of each step of the way. As has been mentioned, you're going to want to itemize costs and get quotes to support them. And sometimes you'll actually have to append the actual quotes to your grant to essentially prove that the costs are what you say they are. But this can vary by funding agency as well. And so it's really important not to pad the budget, but it's equally important not to make sure that you've left yourself short. So you need to properly fund your project. And so this is just an example actually of the project timeline from our larger CIHR grant, which was a $2 million grant. And you can see here, you know, multiple different instances happening along the timeline. You're seeing startup of randomized controlled trial, the sites are not joining at the same time. You've actually got the recruitment phase. It's showing when the layered on qualitative studies are beginning, biological sample processing and collection, when there's DSMB meetings and papers are planned to be published. So this helps you to think about what the associated costs are for all these activities, and also a timeline as to how long, when and how long they're going to need to occur. It's important to account for annual inflation when you're budgeting for your salaries, when you're budgeting multi-year. At McMaster, we're advised to budget for 4% for inflation, even though inflation has been below that for at least the last 5 or 10 years. You need to consider unknown and fluctuating costs, so things like materials and currency conversion. Constantine can speak to this, but during the pandemic, I believe there was a real spike in the cost of reagents and some laboratory supplies because they became in high demand due to clinical requirements for COVID testing. So Constantine, I don't know whether you were personally affected by that or know anyone who was.
We're always personally affected by that because it's always a problem. I think one of the things to consider, and it's an unofficial law that people can think about, is when we talk about reagents. For example, if you have a graduate student in the lab, people would say budget $1,000 a month for things that the person will use. Always remember, this is actually US $1,000, not Canadian, because most of these things that we buy actually come from the US. Typically, they're manufactured there or resourced from there. The costs are passed on to us if we, if we have to pay more. Very few people actually would not raise the cost on the consumer. So it's always good to have that, additional, whatever it is, 20-25% extra to think about as an additional cost. And I think this is the same thing we're facing now with COVID, where there's not only prioritization of reagent use in the US itself, but the currency differences and the inflation costs are just been passed on to the different investigators.
And the couple of other things I've noted here, by no means is this list exhaustive, but remember, you need to account for time and costs of project ramp up and ramp down of activities. It may look good on paper, but if you're running a multi-center randomized controlled trial, your 10 sites are not going to start recruiting on the same day and finish recruiting on the same day. And then finally, you need to anticipate the likelihood of a budget cut if you're a new PI. It's pretty standard for CIHR to cut anywhere from 20 to 25% of your budget. So, unfortunately, funding for trainees is often one of the first things to go. But you need to think of where those funds are going to come from and what the likelihood of a budget cut is. We have a couple of budget examples. Again, this is primarily directed at trainees who maybe have never actually seen a budget before. But you can see, as we talked about, you've got your 4 classic sections. You've got your personnel up at the top, and supplies, equipment, and other expenses. So this is actually a real budget from a pilot clinical trial. So you can see that you've got a research assistant who's got a grade in step, an hourly rate. It shows 36% fixed benefits on top of that. Because this is a smaller budget, it actually shows the number of hours that are budgeted for, because in a smaller budget, you often don't have the luxury of hiring a full-time research staff for a year or 2 years, because that expense is beyond what you can afford in a budget that's $50,000 or less, or even $100,000 or less, depending on the skills that you need. And then one thing that's noted here in the budget is statistician. This is something that I didn't include actually under personnel, because statistician may or may not be something that you can include in the personnel section. So if you have a senior statistician who's a professor at the university and they're actually an investigator on your study, then you can't pay them as personnel because they're an investigator. And the way it works at our institution, and I think at many other sites as well, is your statistician is someone who's an expert in clinical trial design and planning for analyses, and they help you shape and design your trial and contribute academically. But when it comes to actually crunching the numbers and doing the coding, that's actually a data analyst. And so that's actually paid out as a service. Under supplies, you can see computer and software listed like we talked about. And then under other expenses, you've got randomization fees and some other costs such as database setup and meeting support. This is, if you print out a CIHR budget from an operating grant, this is what it looks like. It looks a little bit different, but again, you can see that you've got your personnel section, which includes both research staff and research trainees. You've got material, supplies, and services. You don't see equipment there because there's no equipment budgeted in this grant. And then you have travel and other expenses down at the bottom. So regardless of whether your operating grant is for $50,000 or $2 million, your budget is going to get spit out and be on a single page just like this. I think this is one of Konstantin's budgets, so I'll let him speak to this.
So yeah, the budget, again, it probably won't deviate very much from what Melissa was chatting about. So again, you can see that, for example, in this study, we had 3 centers, and then the costs were divided for personnel depending on the center where the study will be conducted. We also had a lab technician cost and a graduate student cost built into the application. So this is mostly, again, the salary component. And if we can move to the next page, thank you. So if you look at our materials and supplies, again, this was a project that involved animal work as well as clinical components. So the usual cost, again, under materials and supplies. And we also had a component that required more lab-based costs. So for example, we required some kits to purchase. We had mouse work to be done that included metabolic cage monitoring. We also then requested more incentives for recruitment and parking. We had a pharmacy component here where we needed the pharmacy to encapsulate certain pills to create the medication and the placebo. So there is a significant pharmacy support cost as well. We had some imaging requests as well. And we also budgeted for our KT. One of the things I would say, you can actually look at the budget justification for any of those items, including the bench component, is to provide enough detail on the budget justification, which is the next section to go into. But that's budget justification is a place where you can actually add a lot more detail to justify the request for the funding that you're asking for.
I just wanted to hop in quickly and just say what Constantine's slide there highlights is he's got research staff from different centers, from different universities included. And it's important that you know what their salary is, because everybody is paid a different salary throughout Canada.
So moving on to the budget justification, we won't spend a lot of time on this, but I do have a few examples I want to show you, and then I think we want to get to the discussion. But your budget justification is really important, and it's crucial that you're not throwing this together at the last minute. It's a narrative explanation of your budget. It justifies your expenses. It reinforces your project can be successful, and it helps you sell your project to the reviewers. And I'm going to show you some examples of how we've done that. So one of the things is when you actually get to review grants is you get to look at a whole lot of budget justification. So the first time I actually saw a budget justification where somebody actually included a table, I thought, wow, this really makes a lot of sense, and it really looks aesthetically pleasing. And often budget justifications don't necessarily have a page limit. So this is a really nice way that you can lay out what's in the section, and then you can go on to elaborate on each item. So I've just highlighted here under the first component, clinical trial manager. It's a full-time 1.0 FTE. It highlights the level of experience. A master's degree is required. And then it goes on to elaborate on all of the different coordinating activities that person's going to be responsible for, so that the agency and the reviewer knows, yeah, you need that level of experience in order to actually get that job done. Here's a great way where you can utilize including trainees in your budget to really help sell your project. And of course, make it exciting for the trainees as well. So you can see here, it says right in the budget justification, this project provides an exciting opportunity for either a post-PhD or post-MD trainee who's looking for a PDF experience. You're going to tailor the opportunity to suit the trainee's interest in career plan, and the PDF is going to build valuable contemporary skills important for a successful career in today's health research environment. So you're really your reviewer is reading that and they're saying, wow, this is a great project. This is really going to be a great opportunity for this postdoc. Here's an example of some justification for laboratory services and supplies. You've got processing fees, as Constantine was alluding to. You're talking about how many samples there's going to be, cost of pipettes, storage fees. Remember, you're going to have to ship samples potentially if you're dealing with multiple sites. And then your publication fees, these are actually significant expense that if you are able to include that in the grant, then you need to be able to justify that. So again, this is one of those examples where as a PI, you can say, look, you don't have to believe me. You can look on these journals' own website and you can see that BMC Research is going to charge 2,200 Canadian, or BMC Medicine is going to charge 4,200 Canadian. And certainly some journals now are up in the order of 6,000 or 8,000 even for article processing charges. So somebody looks at that and then says, you know, this person's budgeting 2,300 for manuscript at times 2. That's a reasonable cost. And similarly with travel costs, you can see the example highlighted here. It's hard for the agency to complain about the cost you're budgeting when you're telling them that you're budgeting based on their own travel awards program and you're asking for the exact same amount to be funded. So just a few points on strategic considerations. Your structure of a budget is going to be the same whether it's large or small. Designing large and small budgets each have their own challenges. When you're applying for a grant, you need to consider whether it's best to submit with a singular project focus versus a large grant with multiple interrelated projects and try and get everything funded all in one go. And then you also need to know that the funding amount you request may actually impact the grant panel that your grant is going to get assigned to. So this actually is key, particularly for clinical trialists, because if you budget more than, I believe it's $250,000 per year, your grant's going to land in the RCT panel, which is much more competitive than clinical investigation. So if you want to fly under the radar and land in clinical investigation, you need to make sure that your budget is going to allow you to land in that grant panel. And importantly, consult with experts in your department and with your health research, finance services experts who can go through your budget with fine-tooth comb. Don't forget to track your project, regularly review your grant accounts when you've got multi-year funding. It's easy to just get immersed in your research for large projects, but we've certainly caught financial glitches where there's been overpayment, and you don't want to be out $7,000, $10,000, $15,000 and figure it out when you're short at the end of your project. There also will be some fluctuation in costs, especially in a large budget, and you need to be able to be nimble in terms of reallocating those as needed. And then finally, towards the end of a project, don't forget about no cost extensions. If you have money, but the work is not yet done, to ask for an additional year to spend out the money as has been allocated. I think in summary, hopefully we've convinced you that budgets and justifications are important. They'll help sell your project. You should consult with people and make sure that you're asking for an appropriate amount of funding, and always monitor and audit your research finances. So with that, I think we went a little bit longer than intended, but I think we have almost 20 minutes left for discussion.
There is a question in the